The Lao People's Democratic Republic is a rugged country. More than 70% of the land is mountainous, and a third of the villages are not easily reached by road. This makes providing health care a big challenge, compounded by linguistic diversity and a national shortage of medical staff. One measure of this challenge is the nearly 30% of married women who want to avoid getting pregnant but are not using contraception. To address this gap, a new community-based effort to distribute contraceptives has been started in several provinces, including Salavan. The initiative is testing whether low-skilled villagers can effectively provide family planning services in areas health professionals are not reaching. Initial results from Taoi district indicate they can. Feeding their family is a full-time effort for Rui and her husband Rai, members of the Paco ethnic group in their early 30s. They agree that their 5 children are enough. They lost 2 others in infancy. Previously, people from Rui's village had to go to a health center if they wanted contraceptives. With the nearest facility a day's walk away, few did. Rui appreciates the access to contraception that the new program has given her.
Now that I don't have to care for more babies, I'm not so tired, and I have more time to help bring food to my family.
I am glad my wife can help me in the fields. Thanks to the family planning worker who comes to our home, I don't have to worry about her getting pregnant again.
Mr. Young has helped Rui and Rai manage their family size. He provides health advice and contraceptive supplies to people in several villages. A medical worker from the district center trained him. She periodically checks his progress. Young travels on foot between villages, walking for hours at a time. Young has come to Trung Treng village to see people who might want to use contraception. He will explain the benefits of spacing births and how the methods work. His first stop is the chief's house. The chief and his wife are already Young's clients, but he reviews the different family planning methods available before he replenishes their supply. He carefully keeps a record of what he has given them. Educating villagers about different contraceptive options they have is part of the job of the family planning workers. This is done both in individual and group sessions. Tip, a mother of 4, does not want more children. Neither does her husband. But she had to convince him that contraception is safe. Now Young is helping them avoid another pregnancy.
At first, my husband worried that I would get dizzy or lose weight and I would not be able to work. I say, look at the older women in this village who are doing it, they are fine. Another baby would be too much work. I need to be able to help my husband. Now that my children are older, I can go to the field without them.
Tip has decided to use the pill. Young gives her a 3-month supply and records the exchange.
I find it satisfying to help couples have only as many children as they want to have. But traveling from village to village is hard, especially in the rainy season. Sometimes I have to swim across the river.
Soye, age 20, has already been pregnant 3 times. She and her husband, Ngi, are poor, and food is often scarce. They recently decided to start practicing family planning with Young's help.
Before we got married, we agreed that 2 children would be enough. We cannot afford more. If Young didn't come here, I would have to earn extra money so I could travel to the hospital for contraception.
Cost and distance make it hard for residents to leave their villages for any kind of health care. Young counsels pregnant women to go to the district hospital for periodic exams and to deliver their babies, but few do so. Local traditions put mothers and infants at further risk. Most women give birth on their own, either in the bush or in isolated shelters. Sami, age 18, expects to have her first child in about 6 months. Her husband will build her a birthing shelter outside the village. Sami's neighbor gave birth 3 times in a similar shelter.
I was always alone in the shelter. I cut the umbilical cord and buried it myself, and I stayed in the shelter for 5 days after the birth.
When delivery does not go smoothly, mothers and babies without medical care face great danger. Pen was brought to the Salavan Provincial Hospital after suffering obstructed labor for days, her stillborn baby still inside her. Pen's neighbors carried her from her birth shelter to the village, 2 hours away. It took more hours to arrange transport to the district hospital. It was not equipped to treat her, so she had to wait again for a ride to the provincial hospital.
My wife was in great pain. I didn't know what to do. I had to pay a lot of money on a piglet to have her carried to the village, and even more to get her here. And I was afraid we would have to pay a fine of 1 buffalo if she died on the way.
There is a widely believed rumor that if a person dies while being transported through another village, her own village must pay a fine. Amsao, a village chief, says this belief keeps women from getting timely medical help.
Deciding to take someone to the hospital always takes time, since the villagers worry about paying a fine and transport is not easy to find. It would be better if women gave birth at a health facility, but they are too shy and too poor.
Given the danger inherent in isolated childbirth, preventing unwanted pregnancies is important to save lives. The Lao government is developing long-term plans to deliver health services closer to remote ethnic communities. But until this can be realized, contraceptive distributors like Yuang are filling an important gap.
ป่าสนที่อยู่เขตทางไกลซอกเล็กเข้าถึงการบริการทางด้านแม่และเด็กนี้ได้ในเวลาที่พวกเขายังมีจำนวนพดุงครรภ์ที่จำกัดนี้นะครับเจ้าคิดว่าพวกเขาต้องเร่งใส่เรื่องการกั้นพยาธิเป็นต้นต่อในการกั้นพยาธิเป็นต้นต่อนี่ก็หมายความว่าศึกษาผมสุขศึกษาแล้วก็มีแผนการปลุกระดมผู้หญิงลาวโดยทั่วไปในนั้นว่าเกิดลูกห่างเนาะ
Grandmother Yaktem remembers the days when villagers could not plan their families. It was hard having so many children. I could never leave the village. Women today have it much better. They can decide when to have babies.
Rock back the burner.